we don't want to get to that point, right? We don't want to get to that point where you have to put your foot in the boot. What's up, guys? This is Minsu Kim from Physio First Physical Therapy, and as you can see, I'm driving to work. You guys know from past videos that a lot of my talking is done as I'm driving to locations because we do in-home physical therapy. So I'm driving to my patient right now and wanted to talk about Achilles tendonitis. Just going over what it is exactly and some simple tricks that you can do to try to decrease your pain. So let's get started. So Achilles is where your calf muscle attaches to your heel in the back. Everybody knows what their Achilles is because without it you can't walk. Basically any type of activity such as running, jogging, even hiking, or as simple as walking, you need that propulsion. So the propulsion comes from push through your toes, and without your Achilles you don't have that. So now tendon is an attachment from muscle to bone, and it's the connecting point. So it takes a lot of force and of any type of power that's generated from your muscles. So especially like we just said, when you do a lot of push off, right, with your calf muscle, the more force that's generated, the more stress that's placed on the tendon. And with a lot of things, it becomes overused. What tendonitis is basically a thickening of the tendon because of some type of mechanical problem. And we'll go over that in a little bit, but the tendon becomes overused, it becomes inflamed, it actually gets thicker with more blood vessels, more nerve endings that are forming within there. So that's why you actually feel pain. I've seen patients where inside their Achilles it looks like there's a marble inside, so you can actually physically feel it. And that's just basically your body's reaction to being overstressed. Now let's talk about mechanical problems with the ankle that cause Achilles tendonitis. So you have a push-pull between the Achilles tendon and the plantar fascia. So if the ankle is really tight, meaning you don't have enough dorsiflexion, plantar flexion, where you can go up and down with your ankle, then what happens is it puts stress either through the Achilles tendon or through the plantar fascia, or both, a little bit of both. So first thing to do, and this is probably the simplest thing to do, is ice the area. The plantar fascia and the Achilles tendonitis area both are very superficial to the skin. So there's not a lot of muscle, there's not a lot of fat that surrounds the tissue. So from the skin to the actual tendon is very, very thin. So get a nice big ice pack, you know, if you want to use like green peas, whatever. Anything that can really keep it really cold is good, and you want to do that regularly, probably every hour for about 10-15 minutes on and off throughout the day, especially if you're active, especially if you're moving. So the more you move, ironically, it feels better because the tendon gets warmed up. But at the end of the day, or at the end of the activity, when you're sitting there doing nothing, it'll get more and more painful, it'll start throbbing. So you want to make sure you ice. And then you want to do what's called eccentric exercises. You can strengthen your leg while you are lowering your heel down. But an eccentric exercise, what it's doing is you're lengthening the tissue as you strengthen the tissue. Now, there's a lot of research out there that says with a tendonitis that you need to lengthen it and strengthen it at the same time. Hold on, I'm making a right turn, okay? So when you lengthen and strengthen is when you're actually creating the most changes. The third thing to do is, in all honesty, you want to decrease the amount of activity that you're putting. You want to decrease the amount of stress that you're putting through it. Now, I know that's hard for a lot of active people, but you need to give the tissue enough time to heal. Now, when I say enough time, 6 to 8 weeks, you're looking at probably a couple months of decrease the amount of activity that you're doing. in a worst case scenario, you'll either put your foot into a boot or some type of splint to basically not move that ankle. And we don't want to get to that point, right? We don't want to get to that point where you have to put your foot in a boot, because then you're really not going to move it. You're going to get a ton of atrophy in your calf. You're going to have to go to physical therapy to strengthen that muscle up again. You're going to have to go in there to stretch your ankle joint out again. So we do not want to get into a boot. Trust me, you do not want to get into a boot. That's the one thing you don't want to do. So don't go and be like, I'm a weekend warrior, it'll get better over time. I guarantee you will not get better over time if you just keep pushing it the same intensity every single time. You have to decrease your activity level, and not forever, but for a short period of time you do. So hopefully this information helps. If you have any questions, please feel free to message us down in the comments below. You can look us up on our website at physiofirstpt.co. So thank you so much, guys. Thank you for taking time to listen to my rambling. Thank you, guys. Have a good day. We'll talk to you soon. Bye.